Acentra Health is the Beneficiary and Family-Centered Care Quality Improvement Organization, or BFCC-QIO, for the 29 states shown on this map. We perform three services for Medicare beneficiaries: appeals, quality of care reviews, and immediate advocacy services. Acentra Health also conducts higher weighted diagnosis related group, or higher weighted DRG reviews on behalf of the Centers for Medicare and Medicaid Services, or CMS, as part of the BFCC-QIO program. These post-payment reviews check the accuracy of inpatient hospital claims that have been adjusted to a higher weighted DRG after the initial payment. The goal is to ensure that claims accurately reflect coding and medical necessity. This is done to safeguard both the integrity of the Medicare program and the trust of its beneficiaries. A higher weighted DRG review begins when an inpatient hospital claim is resubmitted for additional reimbursement due to coding changes. These changes are typically due to the addition of complications, comorbidities, or procedures that shift the claim into a more resource-intensive DRG. There are two key components of the review: DRG validation and medical necessity review. For DRG validation, certified coding professionals review patient records to ensure that submitted codes are accurate, complete, and fully supported by the medical records. All reviews follow ICD-10-CM/PCS coding guidelines and official coding references. When clinical input is needed to validate coding decisions, board-certified, actively practicing independent physician reviewers are engaged to provide expert review and confirmation. For a medical necessity review, all medical records undergo an initial screening to identify potential concerns with medical necessity. Records that do not pass this screening are then referred to board-certified, actively practicing independent physician reviewers for review. These physicians evaluate the medical record to determine whether the inpatient admission and services were medically necessary using national coverage guidelines and CMS criteria. You may be wondering who is subject to review. Hospitals that submit adjusted claims leading to higher weighted DRGs may be selected for review. Selection is based on CMS's audit protocols and national data analytics. Acentra Health will request medical records. Therefore, your QIO liaison or medical records contact needs to be up to date to avoid potential non-payment denials for lack of medical records. How does the higher weighted DRG review process work? Acentra Health will send medical record requests to the appropriate points of contact. It is important to note that records must be submitted electronically to our medical records upload page, which will be listed in the description box below. Before making any corrections affecting DRG assignment or medical necessity, the hospital will be provided with an opportunity for discussion. If the hospital does not respond to the opportunity for discussion, the initial findings will be made final. The Medicare Administrative Contractor, or MAC, will be notified of the change for claim adjustment. If the change involves the denial of an inpatient admission, the Medicare beneficiary will also be notified. If the hospital responds to the opportunity for discussion, the response is taken into consideration by Acentra Health when making the final determination on the claim. Hospital samples will consist of claims reviewed within a rolling period, and a summary report with all review findings will be issued for educational purposes. An educational one-to-one teleconference will be scheduled with the hospital when results from a provider sample indicate a need for education. For providers seeking to better understand the policies and procedures that inform higher-weighted DRG reviews, Chapter 4 of the QIO manual outlines the official processes BFCC-QIOs follow when conducting case reviews, including DRG validation and medical necessity assessments. It serves as the most direct reference for how Acentra Health completes higher-weighted DRG reviews on behalf of CMS. You can download the QIO manual at the CMS website. This information will also be available in the description box. If this video was helpful, please subscribe. Click the notification bell, and you'll get notified whenever we post a new video. Thanks for watching. If you have questions about Acentra Health or resources we have available for healthcare providers, visit acentraQIO.com/providers. The YouTube video description has useful links and additional information as well.